Dr. Venkatesh. Welcome to the Block Club Chicago podcast.
Thank you. Thank you for having me. I'm really appreciative. It's really exciting.
A little bit of your background. Where did you go to school and how'd you end up doing what you do now?
Oh yeah, for sure. I grew up in Dayton, Ohio. That's where I'm from. That's where my family is from. I went out to Boston for college and medical school, was there for a while, and then came back to Chicago in the Midwest. I was at Northwestern for my residency, and I did a combined residency in both internal medicine and dermatology. And now I'm a practicing dermatologist over at Rush. I have clinic locations. My main location is at Rush River North, and it's kind of near where I live, so I love being kind of in the neighborhood here. And then I have a specialty clinic in a rare skin disorder called cutaneous lymphoma, where I see patients over in the cancer center at Rush as well. So a little bit of everything, but I practice mostly general dermatology, and sun safety, sun awareness is a big topic that we talk about all day, every day.
How'd you get interested in the skin, or was it just
Yeah.
popped up?
Kind of fell into it. I did some research in melanoma when I was in medical school, and so that was kind of my foray into it. And I was like, well, I can do this both from like a helping take care of patients, prevent this, and also help treat it in the future. So that was kind of my first interest, and it grew as I went through school.
I don't mean to make you guess at this, but what percentage of people wear enough sunscreen? Is it
Um,
less than 1%?
yeah, I would say not many. I don't think I can really put a number on it. And that's me included, right? I mean, it's easier said than done to be like, wear a ton of sunscreen every day and reapply every 2 hours. But I think it's something that we can all be better at. And it's something I definitely harp on a little bit.
Yeah, I think that we are good at it when, like, for instance, if I'm having a day of on the boat, I'm like,
Yes.
duh,
Yeah.
sunscreen day, a parade. Okay,
Yeah.
I'm going to wear sunscreen. But when I go mow the lawn at 11:30 and it takes me 45 minutes to do, I don't do it. And
Right.
that is more repetitive than the boat day. Or
Exactly. I mean, and it's the everyday things we don't think about. It's like me commuting to work. I walk to work and I'm in the middle of the morning. I should be wearing sunscreen and reapplying during that appearance. When I walk home in the afternoon, like I should be doing that as well. When you drive a car and you're getting UV radiation through your car window, that's a good time to remember to put some sunscreen on. So it's these everyday things that we don't really remember, but you're right. When we have a beach day, we're like lathering it on. Everyone looks a little bit covered at the beach, but it's these everyday things that it's kind of hard to ingrain into your schedule, but it's something to really think about.
well, it's also a generational thing. I think that has changed over the years. I can picture my grandmother, God bless her, at the pool, her above ground pool on the northwest side of the city in the summer, listening to the Cubs games on the radio. And I can guarantee she did not wear sunscreen.
Yes, I think things have changed a lot, and it's getting better and better. Our sunscreens are getting better and better, and so it's something that I think our generation is doing more. But we need to educate everyone, and it can help prevent a lot of problems down the line for everyone.
Can you kind of describe, as like I'm 10 years old, the science behind skin cancer or what you develop? Because when I think of cancer, I think of like rapid cell growth
Yes.
and big, like a tumor or something that is so, I don't want to say so obvious, because obviously in internal organs, it can be the
Yeah.
opposite. But what is the interaction with the skin? Describe it a little bit.
Yeah, that's a really good question. So most skin cancers are caused by UV radiation from the sun. The sun emits two main types of UV radiation. One is called UVA, the second is called UVB. UVA will kind of penetrate a little bit deeper into the skin and causes aging and wrinkles in people. And so that's another reason to wear sunscreen is to protect against that aspect of it. And then the second is UVB. It penetrates a little bit lower into the skin, but causes burns. Easy way to remember, UVA is aging, UVB is burning.
Hmm.
So what happens is that this UV radiation will hit our skin cells. Our skin cells have a pretty quick turnover compared to a lot of the cells in our body, and that will cause DNA damage within those cells. So that DNA damage will replicate over time and then cause skin cancer. For most people, the UV radiation that you get today is not going to cause a skin cancer tomorrow. And that's the hard part about sunscreen is you're not seeing that effect down the line. But if you get a sunburn or if you're getting a lot of UV radiation on the skin, you are then causing skin cancers. That's like a 10-year or 20-year process. That's something that you're preventing down the line in the future. And skin cancers can sometimes be like those kind of bigger tumors and bumps and lumps that pop up really quickly and can look obviously like a problem. But some are a little bit more subtle. And that can be also a problem is that you're like, that pimple, it's not really going away. I'm not worried about it. Let's just watch it. But that could be a skin cancer. And I think that's part of the issue with sunscreen is that you're not seeing that obvious skin cancer pop up in the next couple of weeks if you get a burn. It's something that's going to cause problems down the line. And that's why it's so important to protect your skin now, because you don't want to have these issues when you're, down the line and, have to deal with it in the future.
I don't know if there's stigma is not the right word, but there is this sense of, oh, well, skin cancer treatable. You're going to see it right away, quick, and it'll be fine. And in many cases, great. That is
Yes.
probably what happens,
Yeah.
but
Yeah.
it can be
But
serious.
yes, and that's not, I agree. It's one of those things where the vast majority of the skin cancers we treat, we have great treatments for them. It's most of the time, the most you're going to have from it is a little scar that we do when we remove it. But sometimes it can be bigger and sometimes it can be a bigger problem. And it's about that risk discussion and that risk benefit where if you want to avoid kind of the major issues that can happen from skin cancer, and skin cancer can be life-threatening, it's worth doing something simple like wearing a sunscreen or using sun protection now so you're not having that problem down the line.
Let alone the aging. My goodness.
Let alone the aging. That's if I can convince you of anything, you'll get wrinkles. So you can wear sunscreen to prevent that too.
Yeah, no, that's a great point. I feel like also, since we look at it every day, our
Yeah,
skin,
yeah,
subtle changes almost are blurred. It's not like when you have a
yes,
noticeable change in your gastrointestinal, like what's happening
yeah,
inside of you, which still get checked out because people will ignore
yes,
those things over time. Also, like skin gets little things on it,
yeah,
right? We grew up
yeah,
with the rashes now and again, or a birthmark, or something. I feel like all of that kind of combines to a complacency about our skin that, well, and not to mention there's areas we can't see.
yes, exactly.
So is I guess all this to suffice to say is, what's the best practice? Is it
Yeah.
get your physical and actually ask for a dermatological, is that even the right word? Follow
Yeah.
up on everything? What should we be doing?
It's really tricky and it's different than, your doctor will give you a recommendation. We have clear recommendations from the US Preventative Task Force that says get your colonoscopy starting at this age and you should be getting it regularly. There's not as clear guidelines for skin cancer screening, and so that can be a little bit tricky. What I tell most people is at some point in your life, ask your primary care doctor for a dermatology evaluation. What that means is you come to us in clinic. It's a usually 15 or 20-minute appointment where we look at your skin head to toe. And I have this little magnifying glass that I look at every single spot. Like I start at your scalp, we go everywhere, we look at everything. And we can kind of decide, are your growths something that we need to be worried about? Is this something you need to come in every 3 to 6 months to get checked out? Or can we kind of stretch that out? Are you a once a year check because you maybe have a family history of skin cancer? Are you every couple of years? Because I'm not seeing much now, but I want to make sure I'm monitoring you down the line. So it's a risk benefit discussion between each person. It depends on your skin type. It depends on your family history. It depends on what I'm seeing. And it depends on whether you've, used sunscreen consistently, had a lot of burns in your life, were a lifeguard, had tanning bed use in the past. So we kind of put all that together and decide how often you need to come in to get checked. But I recommend at least once get that baseline evaluation and then we can make that decision.
That's exactly what I was going to say. The baseline, right? You want to like kind of see what, if there's an issue, of course, get it solved. But if there's not, someone to look at and you to look at maybe along with them,
Yeah.
what is there that is normal? And then you can start to identify, like I said, those things that pop up.
For sure. And it's hard, like as we get older, things pop up. There are a lot of different growths that pop up that aren't necessarily skin cancer that look really funny. And you're like, what is this? Like, why should I be checking this out? And what I tell people is if something comes up and you're like, this doesn't look right, come in to get it checked. It's very easy for us to just take a second look and we're like, I'm not too worried about this. We can watch this over time. Or, let's just take a little biopsy sample and be double sure.
Does skin cancer, I'm sure it depends, if it is something bad, does it itch? Is it painful or can it be completely not painful? And that is prompts no visit.
It's a really good question. It's kind of all of the above. That's the tricky part about this. And that's why sometimes, like us looking at it by ourselves without the magnifying glass, without taking a biopsy sample, it's hard to say. So I tell people there's three main types of skin cancer that we see related to sun. The first is something called basal cell carcinoma. That's the most common type of cancer in the US and the most common type of skin cancer. What this typically looks like is it can be like a shiny little pimple, and I typically see it somewhere on the face. So if it's a pimple that's bleeding, that has like a couple of funny blood vessels, and it's not really going away over time, that's the most common way people notice this. Now, can it look a little different? Yeah, sometimes it can have pigment dots, sometimes it can be a lot larger, sometimes it can have a little ulcer in the center, but for most people, it's this shiny little pimple that's not going away. The nice thing about basal cell skin cancers is they're very, very treatable. They don't typically cause major issues in most people. They typically just grow slowly over time. What we recommend is having that treated with some sort of surgical procedure to make it go away. And there's usually a 99% clearance rate, and we don't worry about it. You're left with the scar. The second type of skin cancer, that's the second most common, is squamous cell skin cancer or squamous cell carcinoma. This can look similar. It can be like a little ulcer on the skin that's not going away, that's bleeding. Sometimes this can grow a little bit faster though. So for some people, they'll be like, it's this little bump that's growing on my skin that's bleeding and it came up all of a sudden out of the blue. And so it can look a little bit different and it may come up a little bit faster. These also we typically treat with little surgeries, so most of the time you're left with the scar, but these do have a little bit of a higher rate to metastasize. So for folks that have it on the head and the neck and on the ears, I'm a little bit more cautious. Sometimes I recommend imaging to make sure we're not missing anything internally, but I take these a little bit more seriously than basal cell skin cancers. And then the last and the most serious is melanoma. And this is the one that we hear about. This is the one we really want to protect against most commonly. So melanoma, they typically arise from pigment cells that we grow in the skin. So most melanomas are pigmented, so they'll look funny colored or different colored or darker than the rest of the bumps on your skin. Sometimes they're not, sometimes they're pink bumps. These can be painful, these can grow quickly, these can grow really slowly. So it's hard to say. These are the ones that I'm most cautious about and the ones that we need to look at most closely because it can start as a freckle on your skin and grow really, really slowly over time. And it's hard to keep an eye on, or it's something that we keep an eye on and we don't kind of notice over time. Or it can be a new mole that pops up and that's a little different than your other moles. You'll kind of see the American Academy of Dermatology has kind of a way to keep an eye on these. We look at the ABCDEs of melanoma. You're looking for something that's asymmetric, that has a funny border, that may be multicolored or a different color. It's a little bit bigger in diameter. And the biggest thing is change. If you have a mole that's changing in any way, that means it's growing in size, it's painful, it's bleeding, something looks different about it, please come and get that checked. Those are the things we want to be most cautious about because melanoma is the thing that can metastasize, that can cause major problems and can be very life-threatening. And so we want to be very careful about treating these.
I imagine
But
if you're, what was that?
sorry, when caught early, we can treat melanomas very easily. It's again, surgery, we leave a little scar and, we just very, very closely monitor your skin over time.
I think a good rule of thumb is, correct me if I'm wrong, if you're starting to plug pictures of your skin into Chat GPT and asking it, call the
Oh,
doctor.
someone. Yes, that is a really good rule. Even if you're taking pictures of something over time and you're like, something is not right here, just come in. It's a peace of mind thing. We can look at something very quickly and we can help biopsy it really quickly. So it's a peace of mind for everyone, you and me included.
Is there a genetic component to skin cancer, or can there be, or is it simply the sun exposure?
Yes and no. So for things like basal cell carcinoma and squamous cell carcinoma, both of these are typically sun mediated. So it's mostly your skin type. People who are fair skin tend to develop more sun damage. And so it's more UV damage mediated. For melanoma, there's both kind of the sun component, but there's also a family history component as well. So for people that have a first degree relative that's have melanoma, that would be kind of mom, dad, siblings, there is an increased risk of developing it in yourself. And so those folks, I recommend having once a year checkups to make sure we're not missing anything.
Is there anything about Chicago specific that either makes us more susceptible or more protected from the sun, or the sun is the sun? I mean, I don't know if the fact that we are in the northern hemisphere and we really get those direct sun rays
Yeah.
between especially June, July, and August right now. I don't know. Does that make us more susceptible?
So yes, so during the summertime, definitely there is a higher risk of developing, you're out in the sun and there's higher risk of burning, especially in that peak period between like 10 a.m. and 4 p.m. is when the sun is at its peak. We're actually a little bit better protected than some people kind of in the equatorial areas. So I think in some ways we're better off, but still like the sun is the sun. It's such a marginal difference that I think of if you're going to be out in the sun, if you're going outdoors for any reason, it's good to wear sunscreen and to protect yourself. I even tell people when indoors, like we're not discounting, there's UV radiation that comes through windows every day. Like it's good to just have some sunscreen on and make it part of your routine. Because you're having this exposure even all day, every day in the winter time in your car. It's worth thinking about consistently.
I imagine it's a thing about, I mean, if you tell people they have to put it on, lather up all the time, inside and outside, people immediately are going to clam up and say, this is just too much. I imagine it's a gradual thing, a little bit. I mean, you don't want to wait forever to start doing it, but get in the practice of doing it in better ways. And maybe it'll kind of cyclically and naturally, like a snowball down a mountain, you'll start to take care of yourself more and more. But that brings up like, I don't need you to go into brand specific, but like, what should I be looking for on the shelves that I know is something that is good?
For sure. And we're very lucky now that companies are coming out with really fun ways of putting on sunscreen. It's a lot easier than it was before. We don't all have to look like zombies when we, or like, like a ghost when
Yes.
we go out. There's a lot of different options, but that almost makes it harder because you go on the shelves and you're like, what do I pick from? Like there's 10 million sunscreens to choose from. What am I looking for? So I think easy rule of thumb is put some on when you're going on in the morning. You have a few different options to choose from. So when you go to the store, what I recommend is choosing between either a mineral sunscreen or a chemical sunscreen and look for something that says broad spectrum on the bottle because broad spectrum is going to help you against both UVA and UVB radiation. So you're getting
Aging
the
burns.
aging burns, you're getting both. So get something that does everything for you. The difference between mineral and chemical sunscreens, mineral is usually like a zinc or a titanium oxide. It's a metal compound that basically reflects off sunlight. That type of sunscreen can leave that white cast, but is better for people that have sensitive skin. It tends to be less irritating. So those are great to put on when you're going out to the beach, when you're going to be out on the boat for a little bit. But there are better formulations now that don't necessarily leave a white cast. So you can find that in kind of gels, creams, lotions that you can put on every day in the morning. Chemical sunscreens tend to have other ingredients that convert that UV radiation essentially to heat in a way, so you're not getting it directly onto the skin. So they're in makeups and a lot of different products that are really easy to apply. So for people that are like, I don't want to leave a white cast, I want something that's very cosmetically elegant, those tend to fit in that category. So for most people in the morning, it's usually easy to put on something like a cream or lotion or a gel on your face, then you're not thinking about it. Then we have these great products to like reapply afterwards. So there are powders like for people that want to just like brush something on before they're walking out after work. That's like an easy thing, and that's something I have. There are sprays. Sprays are great. The issue with sprays is that you don't often know how much sunscreen you're putting on. That's why it's not the most recommended option. To me, it's like if you're going to wear something, wear something. I'm okay
Right.
with whatever that is. So sprays are great if you're going to go out on a boat and you need to kind of quickly apply something. And especially for kids that are running around, you just kind of spritz them and you get what you need. But there's a lot of different formulas. And what I say is pick something, choose something that you're going to use. Ask for a sample at the store, try it out, see if you like it, and then, buy a larger bottle because, you want this to be part of your routine. If it's fun to use and you like using it, it's more likely that you'll continue. And then the other thing I like, especially for like boat days or like beach days, is UV clothing or UPF clothing. I don't know if you've seen those at the stores. They're definitely a lot like nicer to look at now. They used to be kind of like, I don't know if I'll wear that, but
Very
they've
stylish.
yeah, definitely a lot better. So UPF clothing, it's like a UV protection factor. It's clothing that's impregnated essentially with like a sun protection. So it's easy if you're wearing it, you don't have to reapply sunscreen in those areas. So it's just kind of convenient. You don't have to think about it. So hats, there's like swim protection, like rash guards, etc., that are a lot nicer looking than they were in the past. A lot of big box stores online, you can buy it, and it just kind of saves you from reapplying like on your arms or legs or on your head if you're wearing a hat. It's very convenient in that way.
I think that it's probably great to remind people that they go outside maybe or they look and it's a cloudy day and they
Mhm.
go, "Oh, I'm good." I've done that before. I did
Yes,
that up in
we
Canada
all
while
do
fishing,
that.
and I'm like, "I'm
And
totally fine." And then I get back to the cabin 12 hours later. I'm like, "That was the worst decision I've ever made, not
yeah,
putting
you're
on
like, that
sunscreen."
hurt. Oh no. Yes. So sun UV radiation can penetrate through clouds. So on a cloudy day, there is still UVA, UVB radiation. So it's important to remember to wear sunscreen. And one thing that people don't remember is like in the winter time, actually, if there's snow outside, the snow reflects that UV radiation even more. So it's a higher factor. So I tell people if you're going for your ski trips, if you're going for snowboarding, you're going to be out in the mountains, you have to wear sunscreen there. It's almost a multiplied factor when you're out there in the snow.
I think that part of this is just a healthcare in general. People don't get checked because they don't know what to do. Like, do I cold call a dermatologist? Are they in my network? Are they not?
Yeah.
Do you think the best way is talk to your primary care doctor and
Yes.
let them refer you to someone?
Yes. I think for the vast majority of people, that's the easiest way to go about it. And your primary care doctor is experienced in all of this. They train a little bit in dermatology as well. They can kind of help decide like how quickly they need to get you in to see a dermatologist. But I think that's the easiest way for most people. Now, if you're like, I have this big spot that's growing and bleeding and painful, it may be easier to just come to us directly. I think if you're able to get an appointment, we're happy to try to see that soon. And most dermatologists will have like urgent slots to get people in for these kind of spot checks more quickly if you need just one spot checked out. But yes, going through your primary care doctor who can help navigate the system, give you recommendations for people they like, and have you seen within your network is the easiest way.
What do you like about Rush?
Oh, I love Rush. This is my first job out of residency. I've really enjoyed the community, the people. That was kind of the first thing I was looking for. Number one, we have like great leadership. I really love our chair. He's just wonderful. He's really grown the department. And then we have just a great camaraderie with all of the people I work with within the derm department and outside of it. I can message people really easily. People are willing to help out. So if you need something, we all work together. We all really want to take care of our patients the best we can. So I am really very grateful for having the opportunity to work at Rush.
We did a podcast and people can go back and listen. I'll drop it, link to it in the episode show notes with nurses from Rush. I was
Oh,
blown away at how great they are and how well the system seems connected. There's
yes.
obviously always confusion in healthcare, and there's no guarantee that there won't be little snafus here or there, but it seems like the coordination between different areas of study and different doctors and nurses seems to be a web that seems to catch you when you fall.
Oh yes, I think everybody wants to help. I think that's the bottom line is everyone wants to do their best. Everyone wants to help. And I have to say, like all of our staff, all of the providers, everyone wants to do that. And I think everyone being on the same page definitely helps catch, things fall through the cracks, but definitely helping catch that and helping treat through that is a big part of the rush kind of mentality. I have wonderful staff that I love working with. I have nurses in different departments and we all kind of work together to work through things seamlessly. And so I agree. It's hard to get that coordination and I'm happy we do have it.
Anything else you want to mention to our listeners?
No,
It's
I mean
summer, wear
enjoy
sunscreen.
wear sunscreen, enjoy your summer though. I don't want to take away from that. Enjoy it safely. Make sure you can keep enjoying it for as long as you can. We want to protect your skin in every way possible. And if it's protecting your skin against skin cancer, protecting against aging, do all the things you can to protect that against the long term.
Dr. Venkatesh, this was excellent. Thank you.
No, thank you, John, for having me. It's great to be here.